How do you check? Look at this back of this volleyball player. Look at the right scapula. Is this symmetrical? Look at the prominence. This is not symmetrical. You can do this simple test for your players every month, maybe. You don't have to have the doctor. You just ask that player to lift both arms together and bring them down. Then you can spot. Then you can send the person to a physiotherapist. So what's wrong with this athlete? This right hand, right arm bowler, he comes with severe pain on the right side. What's wrong with it? You can read, I suppose, pec tightness, GERD deformity. I'll tell you about GERD also. There is, for the sake of the coaches, there are several muscles, 36 muscles in the shoulder, out of which a small muscle called pectoralis minor can become short, and the whole system can go haywire. It's a kind of spectrum of disorder. It starts with GERD, internal rotation deficit, then goes on. Here, the athlete is touching the back. Look at the left side. The shoulder blade is so prominent as against the right side because he has internal rotation deficit. A volleyball player, he wants to spike the ball as hard as possible. So he takes the arm as far back as possible. A tennis, when they serve, they have to take the arm as back as possible, arch the back, and then hit the ball 120 kilometers per hour or so. So they go on increasing the abduction external rotation for the sake of the coaches. So this is the movement which they go on increasing at the expense of internal rotation, at the expense of opposite side. But as long as it's balanced, as long as full range of movement is equal both sides, is fine. When there's a deficit, then the whole spectrum of disorders appear. So this is another simple test you people can do. You don't have to bring the athlete to a physiotherapist or the doctor. There are several exercises for this which they can teach, and with that you can prevent any possible disorder or tear of the muscle for the shoulder. Which muscle is the strongest muscle and important for a tennis serve? Forearm, elbow, shoulder, back, leg. Please put up your hand. Forearm, how many of you? One? Nobody? Elbow? The coaches? Elbow? Shoulder? Back? The core. I'm talking about the core. Back, core for the service. Okay, maximum number of hands. I know your people are not putting the hands up or anything. Leg? Not necessarily. It's not the core muscle?
It's the initiator of the...
Okay. Sorry? Oh, the most important. The core, I think, anyway. Yeah. So it is not just arm muscle or shoulder muscle or leg muscle alone. The entire group of muscles is important for a tennis serve. You have to remember that. You can't go on, you can't let the player go on improving the shoulder strength or arm strength alone. It's the core muscle which is very important. How do you test if the core is good or not in the stadium where you're coaching? How do you do? So this is one very player. He tries to go down all the way with one. He's a big player. He finds it so difficult. You're not able to go all the way down. This is a simple test which you can perform wherever you are to see if the core muscles are strong or not. If not, if the athlete is not able to go all the way down and get up without any problem, that means he has to improve a lot of his core. Next, there has been a lot of talk about kinetic chain. They've been saying close, open, and all that. For the sake of the coaches and non-medical people, what is kinetic chain? This is a simple game children play. Ring a roses, I don't know how they play. So they go in a round, in between somebody let go, the entire, the children behind fall off. That we have seen every day today. In the same way, it is the kinetic chain, it works when a tennis player serves. The kinetic energy from the ground to the leg, to the back, to the shoulder, then to the arm, then she strikes the ball. If in this kinetic chain, for example, the core muscle or the back is not weak, or the leg which is not weak, then the whole kinetic chain is broken, and that player is not able to play as well as before. These things you have to take notice of. So the chain breaks, and the player is not able to play properly further. What is somatomotor system? Just motor system, sensory motor system, which is necessary for stability and the normal function of any joint. This system, when it goes haywire because of muscle fatigue, because of muscle weakness, or faulty technique, or muscle tightness, all these things can affect the sensory motor system. Who can spot this? You can spot it. You need not wait until this athlete gets a shoulder problem and then comes. If the athlete is fatigued, you'll have to rest that athlete. Between tournaments, maybe you'll have to skip a tournament. Maybe drop out of a tournament if necessary. You see all the big players doing that very often. They don't hesitate. Only cricket players of our country can be gods and keep on playing until they tear everything down. And they start underarm bowling and all these things. So these are the factors which affect the joint health by affecting the somatomotor system. And you people have to be aware of it, and you people can stop the athlete from getting injured further. Take an example here. You know that when you have to bowl or when you have to spike, you have to turn all around, and rotate the pelvis and hit the ball hard. When, due to faulty technique, the athlete does not turn all the way around, just halfway, and there's so much of force in the shoulder. He tries to hit the same level of, same force, or 110 kilometers per second or whatever, and she tears the shoulder muscles, cuff, injures some cuff or labral tear. So, as a coach, as a trainer, you can spot and correct the technique and prevent this athlete from coming to the adaptive state and then on to allostatic state. So therefore, I am concluding the talk by coming to the set point. So what is set point? When an abnormal and excessive load, the state of allostatic state, if you don't watch out, when they cross the set point, which is variable, to some extent it can move to the right side, then it results in allostatic load, and at that time the athlete gets injured beyond exercise treatment and goes on for surgical time. So this is a time when you people can catch and correct by rehab and prevent this athlete from coming to a state of surgery. So what's the set point? What is the role of physiotherapist? What is the role of So what's the role of the doctors? What's the role of the coaches? What's the role of the trainers? See, on the left, you see the allostatic state, the abnormal state in which the shoulder is going through, and because of fatigue, because of faulty technique or so, this is a time you people can catch the athlete and prevent the athlete from coming to the surgical state, allostatic load state, where the labrum was so broken. So what about we doctors? Very often we think it is definitely a slap lesion, definitely a labral lesion, do a MR arthrogram, all normal. Then we realize there's got a lot of tightness here, there, everywhere, and send them to the physiotherapist. That is the time physiotherapists can correct the shoulder mechanics and put them back. So there is a big role for shoulder, for the coaches, for the trainers, for the athletes, for the doctors, and everybody. It's teamwork. And there is no reason why we can stop the athlete from coming to the surgical side. That if you're knowledgeable, if you open your eyes, if you examine them periodically, and you can stop. So therefore, it is not just, shoulder is not just surgeon's domain, not just physiotherapist's domain, it's all of us put together as shoulder is concerned. Who is this athlete? Finally, final slide. Good, excellent. So why am I showing here? We had our ISACOS meeting in Florida about 10 years back. And he was a chief guest. And he gave a talk in which, and after that we had the opportunity to sit with him for dinner. And he said he never had any injury. One of the few lucky people. Thank you. So let's have So let's get on to that next session and then have a lot of discussions. I also invite Leonard, right? Leonard Pundraj. Leonard, please come up. Who's the last name? Who else? Okay, hand over the dice to them. Let's have a lot of interaction and let's all learn. Thank you.